Friends, recently there has been discussions about, uh, what would be the patient's distance contrast and the depth of focus if you're implanting an EDOF IOL and if you are by any chance landing myopia or hyperopia for the patient if there is a refractive surprise with this EDOF IOLs. Now, to answer this question, I have actually written about it in the quickguide.org. You will find it in the optics section. And before I go into it, just a quick brush up about what is spherical aberration. We know that the marginal rays of light and the paraxial rays of light are not falling at the same place. Paraxial rays of light are the central rays of light, which are passing very close to the optical axis of the lens, and they don't fall at the same place, right? So this is an example of a positive spherical aberration because the marginal rays of light are falling before the paraxial rays of light. Similarly, there is an example of negative spherical aberration. So here you can see that the paraxial rays of light are falling before the marginal rays of light, while in the other example, the marginal rays of light was falling before the paraxial rays of light. So this is an example of a negative spherical aberration, and while here is an example of a positive spherical aberration because the marginal rays of light are falling before the paraxial focus points. Now, when the pupil dilates, the marginal rays of light are actually entering through the pupil and they are finding their way to the retina. Where is the patient's best focus? The patient's best focus is neither on the marginal focus nor on the paraxial focus. It is somewhere in between, right? So we need to know that. So now, what happens with a positive spherical aberration and what happens with a negative spherical aberration? So with a positive spherical aberration, you will find over here in this drawing, this is the patient's best focus. We know somewhere between the paraxial focal point and the marginal focal point, right? Now, with a negative spherical aberration, this is an example of negative spherical aberration, right? Because the marginal rays of light are falling beyond the paraxial focal point. So the best focus is actually after the paraxial focal point. So best focus is here with this red circle. It is after the paraxial focal point. So, if you have an hyperopic outcome, what happens with a lens which has a negative spherical aberration? A lens which has negative spherical aberration, if you are having a hyperopic outcome, and suppose this is the retinal plane, this is the retinal plane over here. So you will find that the best focus is further away from the image plane. So because the paraxial focal point, because of the hyperopic outcome, they are beyond the retina, the best focus is also further shifted, and that's not a happy situation for the patient. On the other hand, with a negative spherical aberration, if you have a myopic outcome, then the best focus shifts towards the retina, which would be beneficial for the patient. However, when you have a positive spherical aberration lenses, and in a moment I will show you which is a positive spherical aberration in the market, which lenses are negative spherical aberrations in the market. Here is a positive spherical aberration because the marginal rays of light are falling before the paraxial focal point. So you have the best focus somewhere in between. Now, if you have a myopic outcome, you know that the best focus is before the paraxial focal point with a positive spherical aberration lens. And if you have a myopic outcome, the best focus will be further shifted away from the paraxial focal point. So there will be a drop in the image contrast. But with a positive spherical aberration lens, if you have an hyperopic outcome, in fact, the best focus shifts towards the image plane, and there may not be that amount of drop in the image contrast. So that is important for us to remember. You can access this article and have more details about this concept. So what the last that I wanted to show you is, as per the peer-reviewed study, which of these lenses have negative spherical aberration and which of the lenses have positive spherical aberration. Most of these lenses, the Tecnis Eyhance, which is an enhanced monofocal IOL, the VVT, which is an EDOF IOL, these are all lenses which provide some amount of negative spherical aberration. Now, Eyhance, we know in the central 1 millimeter, you have a higher power. But if you measure the spherical aberration at a 5.8 millimeter optic, then you will find that the negative spherical aberration is predominant in the Tecnis Eyhance or the VVT or the Bausch& Lomb LuxSmart or the Tecnis POC. But as claimed by the RayOne EMV lens company, they have a positive spherical aberration, and the measured value according to this peer-reviewed study is around plus 0.14 at 5.8 millimeters. So this is a positive spherical aberration lenses. So with this, actually, with this image over here, you will understand which lens actually works best in case you land with hyperopia or with myopia. Thank you very much for your attention.